The ongoing conflict in Syria has resulted in the worst humanitarian and medical crisis in the 21st century. More than 250,000 people have been killed, and over 5 million refugees have fled violence, torture, and rape to neighboring countries. International medical and humanitarian organizations have not been allowed to enter Syria or access the affected neighborhoods to provide medical assistance to the wounded civilians on the ground. Due to the indiscriminate bombing, many injured civilians have lost their lives because of bleeding and lack of access to medical care. Hospitals, doctors, nurses, and healthcare workers who attempt to treat the injured have become a target by government forces. There are significant shortages, not only of medications, medical supplies, and personnel, but also of basic resources such as electricity and fuel to operate the existing medical facilities. The Syrian American Medical Society, SAMS, is a professional non-for-profit organization that represents the healthcare providers of Syrian descent in the United States. In 2011, SAMS responded to the catastrophic humanitarian crisis in Syria. The response has been brisk, dynamic, and progressive. SAMS started with sending medical supplies and medical missions to Syria to help treat the wounded, then quickly shifted into sponsoring field hospitals and trauma centers, as well as providing ambulances and emergency medical training inside Syria. Starting in 2013, and in response to the tragic displacement of millions of civilians inside Syrian and neighboring countries, SAMS started providing healthcare services in refugee camps and paying for the treatment of severely injured civilians in Lebanon and Jordan, as well as providing psychosocial support to the displaced families. With the shifting landscape in Syria in 2014, SAMS started providing wide-scale primary healthcare services, both in rural areas using mobile clinics, as well as large urban communities with multi-specialty clinics and birth centers. In the summer of 2014, SAMS opened its first physical rehabilitation center in Syria and expanded the psychosocial program inside Syria and in Lebanon to cope with the increasing number of physical and mental war-related disabilities. The first nursing school in Aleppo was opened in 2014 to address the massive need for well-trained nurses. SAMS-sponsored projects are diverse and include trauma projects, obstetric and neonatal projects, primary care projects, psychological program and physical rehabilitation, refugee camps clinic support, warehouses and medical supplies campaigns, medical staff training, polio vaccine campaign, doctors and medical staff support, dental programs, telemedicine and tele-ICU, dialysis centers and nephrology programs, and others. In 2014, it is estimated that the team efforts of SAMS have treated 1.3 million people in Syria and the surrounding countries in 95 sponsored facilities. Our healthcare facilities treat all comers, irrespective of their ethnic or religious backgrounds or political views. SAMS is now regarded as one of the most active medical relief NGOs on the ground in Syria, with more than 75 employees working in 9 offices located in the U.S. as well as Syria, Turkey, Jordan, and Lebanon. In 2015, SAMS is sponsoring 43 medical facilities in southern Syria, 45 in northern Syria, and multiple refugees facilities and dental clinics in the neighboring countries. Every day of this conflict is a day too long, and every day that passes, the number of wounded and displaced people rises. Every day the need for help grows. Today, you can help. Join us on our mission to save Syrian lives. Build a hospital, support a clinic, provide medical supplies, train medical staff, empower, support, save Syrian lives.